Hello and welcome, viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm chatting with Dr. Diane DiTomasso. Hi, Diane. It's so good to have you back here at Gold.
It's great to be here. Thank you.
You, of course, are part of the Gold Lactation Online Conference of 2025, and your presentation is titled Information, Guidelines, and Strategies about Breast Milk Expression, a scoping review of the evidence. That sounds fascinating. I want to talk about that in just a moment. First of all, let me know a little bit about you and your professional background.
Well, I've been a nurse since 1989, spent about 25 years working in the hospital as an obstetrical nurse and lactation consultant. And then I transitioned to academia, and I now am a clinical associate professor at the College of Nursing at URI,
Wonderful. Thank you for
University of Rhode
sharing
Island.
that.
Yes.
And you're really into research, and that's why you have this wonderful presentation, a scoping review of the evidence. So that's really fascinating. It's all about breast milk expression. So, what would you say? And I mean, it's a little bit of a broad question. I say that before, but what would you say are some of the common misconceptions about breast milk expression that in your research maybe helped to be clarified?
Well, the reason I did this, this has been an idea for this project, has been percolating for a number of years. As I said, I was a lactation consultant for a long time. From 1999 to 2015 in practice. And then I took a step back for about 5 years, really focused a lot on research. And then I missed it. I missed being with patients. So I got recertified in, I think it was 2021, and I've been working uh, in addition to my role at the university, I have been working in hospital and outpatient lactation settings. And what I was shocked by when I came back to practice after a few years away was the increased focus on pumping. And
Mm,
to answer your question, common misconceptions is that I think the biggest one is that everyone has to pump.
mhm.
It used to be that women didn't even think about pumping for many weeks after they had their babies. But now I had a question from a patient, a prenatal patient, just last week, who thought she had to start pumping before the baby's even born. This is a healthy, woman, low risk. So this conception, this misconception that everyone has to pump and we have to pump right away. And if we don't pump, then we're not going to get a full milk supply. I think that's
Mm.
the biggest misconception out there.
Yeah, that's incredible, and that's so true what you're saying there. I have noticed that too. That pumping starts way earlier than it used to. And even as you mentioned already, in late pregnancy, people are asking. And what you said was kind of really almost like a little alarm went off in my head there when you said these women are thinking they have to pump, otherwise they don't have a full milk supply, right? So it's not just pumping for having, something for the baby for later, if they need to go back to work or whatever, or, but they have to do it. Otherwise, their milk supply is not adequate. And that's, wow, that's a big one, right, Diane?
It's huge. And in my practice in this last 4 or 5 years, I have been shocked by how many problems that are creeping up associated with pumping. And that's really why I did this work, is all the problems I'm seeing with chronic engorgement,
Mm,
oversupply, babies choking and having reflux and engorgement that lasts weeks and weeks
yeah.
after the baby's born. And it turns out, mom's got a freezer full of milk
Yeah.
in addition to trying to nurse the baby. So I really see it causing a lot of problems. And you know, there's, I think it's twofold. The reason this whole thing, sort of why we're here, why is this happening? I think it's twofold. I think it's, we have the pumps now, you know,
Hmm.
in the Affordable Care Act in 2010 now have put these wonderful, really sophisticated pumps into the hands of many women. I wish I had had a pump like this,
Right. Yeah.
30 years ago, when I was using the hand pump in the bathroom,
Yeah.
after I had my
Yes.
children when I was back to work. But we have given women tools, but we have not shown them. I don't think we have given them the education that goes along with that magnificent tool to
Right.
use it to their truly to their benefit. And so for many women, the pumps are great and it's really
Hmm.
serving them very well. But there is a percentage of women that are the pumps are causing problems for them.
Right.
So I think it's the access to this technology. And then I think, and I could be wrong on this, but when women have preterm babies, there's a lot of really good, strong evidence that, directs them to pump early and pump often, right? That's the
Hmm.
mantra, pump early,
Right.
pump
Pump early,
often when
pump
you have a
often.
preterm baby. Very strong evidence. I feel like we've taken that guideline and we have applied it to full-term women. And it's not apples to apples.
Right.
The reason they're pumping is very different and their need for pumping very different. So
Very
sorry,
different.
I'm going on a tangent. I just,
Yeah.
I'm thinking, as when you do this kind of work, you think a lot about the problems and we
Absolutely.
get
Yeah.
here.
How we got here. And another thing I think is also social media, right? Social media is a wonderful thing of moms, new moms staying connected and feeling, especially when you have a new baby and you feel kind of a little bit isolated. So staying in touch with everyone through social media is wonderful. However, also there's a lot of misinformation on social media and a lot of pressure for young, mothers and, parents in general. And then you see these images, these freezers full of milk, right? And everybody's posting it and showing, look how much milk I have, look how great I'm pumping and all that. And somebody might see that and go, oh, I'm not doing that. Oh, I need to do that too. Something is wrong with me, So there is
Exactly
this
right.
added
Yes.
pressure there as well, right? And you brought up
Yes.
a good point about education. It's really on us to really educate on using these great tools and also setting the right expectations or what is really helpful and beneficial instead of this added pressure that many new families feel when they see all these pictures, right?
Yes, you're so right. And I have had taken care of plenty of moms who have a beautiful, thriving, growing baby. But if they don't have a stash also, they sometimes feel inadequate.
Mm-hmm. Mm-hmm.
And it's like, no, you look at your baby. You have
Right.
enough. You have enough. And I think you layer on the challenges of being working outside the home.
Yes. Hmm.
And that puts tremendous pressure on women. And I do believe that also makes them feel compelled to have the stash, right?
Yes. Hmm.
And so it's complicated, for sure.
It is very complicated. You're right. And now talking about research, you mentioned there's a lot of research and evidence, on preterm babies. When you looked into this, into your review there, was there a lot of research on pumping? Was it research that is, that you felt like useful to kind of take into practice, or so tell me a little what you found there.
So, I this review really focused on full-term women. I didn't want to look at the research associated with premature birth, and so that was exclusion criteria. And so, uh, we looked at about 1,400 articles, and we whittled it down to 62, and that was over a
Uh-huh.
10-year span. So we were able to come up with 62 articles. Um, Sadly, we broke it down into, I have the list here, of several categories. The first was consequences of milk expression. There was about 10% of the articles was on that. Women's perspectives, there was a lot of articles on women's perspectives of pumping.
Hmm.
26% of the articles were on that. Another 25% of the articles demonstrated that women needed more information about pumping.
There you go. Yeah, it
There you
is
go.
exactly what you mentioned there, right?
Exactly. Another 10% or so was about exclusive pumping. And finally, the smallest category, And this was very telling. Oh, I'm sorry. There was a technology. About 20% of the articles was about the technology of pumping, right? The
Hmm.
development of new technologies, 20%. And then finally, the smallest category was on strategies. How
Oh,
should women actually be pumping? Like the good information, right? The how often did they do it? What kind of the pump did they use? When should they start? When should they stop? There was only 6 articles that we
wow.
found that
Yeah.
spoke to the different strategies. So obviously in the presentation, I'll go through all the
Yeah.
categories, and I'm going to spend a little more time on the small category of strategies because I feel like when people log into this talk, or that's what they're looking for. I
Right.
wish there was more strategies, but I
Yes.
will share, of course, those that revealed themselves in this review.
Absolutely. That's absolutely fascinating. And you also then also showed the gaps in research there, right there. We need more
Yes.
research on that.
Yes.
Absolutely. Oh, that's yeah, very interesting. So Diane, before I let you go here today, what are you hoping in general that our viewers will take away from watching your presentation?
Well, I think that I want them to take away the latest evidence.
Hmm.
What is the latest information that we have?
Yes.
Um, and see the gaps. And I'm hoping that maybe they'll get inspired to do some work in this area because women are, uh, and also be inspired to educate their patients about things like duration, frequency, what kind of pumps used, and mostly how, when is it appropriate to be pumping and the realities of breastfeeding uh, as it relates to milk expression.
Great. And this is evidence-based information. That's what we need. It's not just some
Yes.
hearsay or something,
Right.
we learned maybe along the way, but this is really information based on evidence that we can really take and utilize and hopefully inspire some people to go into research and do some more research.
Absolutely. And start filling in some of these gaps.
Yes, yes, absolutely. Well, thank you so much, Dr. Diane DiTomasso, for being here with us today. And so looking forward to your presentation here at Gold.
Thanks so much.
And now some information for our viewers. If you're really excited about this presentation, want to learn more, of course, we invite you to go to goldlactation.com. There you'll find information about the entire conference. All our presentations are live and recorded, and we have an upcoming keynote presentation that is open access and free to everyone. So make sure you check that out and share that information with your friends and colleagues in the field. And I hope to see everyone at the conference. Bye-bye, everyone.